Hi, this is Scott Pop. We're talking about upper quadrant mobility, neck, mid-back, and shoulder. They all work together. And so what we're going to do is demonstrate the 5 positions that I use my cervical bridge, but it's really a shoulder stretching mobility tool and upper back mobility stretching tool. And what we start with is in the cervical spine here, working the cervical joints one by one. You start up at the upper level, work with rotation. You're looking for tender areas that you can spend a little time. If it's tender, spend a little time over there, roll up and down, really work that tenderness, loosen up that fibrotic tissue. Great for neck pain and headaches and tension headaches. Roll back and forth. And you can flex, extend, laterally flex on there. And you want to just kind of slide your tool down a little bit, work down each little segment. Same thing, rotate, hold it, laterally flex, go up and down. So you can see he's finding some tender spots in through there. And he's going to work all the way down into his upper back. So the next thing you'd want to do with this tool to work the upper back is you take it apart, okay? You lay on that tool on one side, mobilize right along the spine, let your head go way back like that, and then just tuck your chin and kind of curl up and really try to work those segments on each side. You can spend even up to a couple of minutes doing this. It's going to be a little bit tiring to your neck flexors, but it's a good thing to couple the neck flex. You can just let your head drop like that and let your scapulas drop. That stretches that mid-back. And we want to move it over to the other side. I'm going a little fast here just to get through it all. Work it up and down like this. Okay, so that's neck and upper thoracic spine. Then we're going to sit up and put it together. And either side, Tom, it doesn't matter which side you lay on. Now we're going to work on the scapula, the under position of the scapula here. These are the latissimus muscle, the subscapularis, and when they're tight, it prevents the scapula from moving upward. And so he's going to lay over that and really stretch that scapula up and find that tightness and tender spots in the lat. This is for good abduction of the scapula. This is position number 3. Okay. Next position is going to be for retraction of the scapula. You're going to put this at slightly an angle underneath the pectoral muscle, and see how this pushes the shoulder blade back a little bit and it stretches the pectoral tendons. This is getting right underneath of the anterior shoulder capsule there, and he can move his arm around a little bit, rotate it around, find those tender spots, move it in and out through the pectoral tendon. You want to find those trigger points in through there and really let his upper body sink into the floor. Again, this is for retraction of the scapula here. Good. This is position 4. And position 5 is again this way, and you're going to put your arm up and you're going to roll on the back side of it, okay? Gets a little sharp sometimes right in through here. This is for rolling the scapula forward and getting under the rotator cuff muscles, the shoulder ones, the infraspinatus, teres muscles, and some of the lower trap muscle of the scapula. This helps the scapula mobilize it forward and works on the trigger points on the posterior part of the scapula. This is position 5. A great protocol for neck pain, upper back pain, shoulder dysfunction, impingement syndromes, because you're working the full range of motion. Forward, back, up. There's one more position I'm going to show, and this would be position 6. And this would be using our neck flosser. Tom would be putting this, slide this way a little bit for me, Tom. This is using the neck flosser, and it's using the upper trap. And you're going to take your hand right here, Tom, push down like that, and tip your head down and away, and turn your head a little bit to the left for me, Tom, a little bit like that. And this is working this linkage, the upper trap and levator scapula muscle. Good. So this is actually position 6. So a great protocol for loosening and lengthening all the scapular muscles, upper back and shoulder. Everything functions together in the upper body. You can even link it to the lower body. But if you focus and use this neck bridge, on the previous video we showed you how to make one. It's very simple. There's 1/2 inch PVC, 6-inch pieces, a little tripod at the end that you can use. The mid piece is 12 inches. Just put it together just like you can buy this at any hardware store, or Home Depot is where I got this. Just cut these PVC pieces. It makes a nice little solid bridge, and it's a great tool for self-treatment. You can do this every day. You're not going to hurt yourself. Obviously, if you spend too much time, you could be a little bit sore, but just spend 5 minutes, 5 to 10 minutes mobilizing your upper back, your shoulder, and your neck, and I think you'll really free things up. So thanks for watching Mobility Minute.